Hello, and thank you for joining us today to discuss how workplaces can support and make a positive impact as the millennial generation enters the perimenopause stage. This is an incredibly timely and important conversation. Millennials, who are now in their 30s and early 40s, represent the largest segment of today's workforce and hold significant influence. In fact, together with the Gen Z population, this cohort is projected to make up 74% of the global workforce by 2030. Employers face a growing demand to design well-being benefits that consider the unique health needs of women in all stages of their lives. When it comes to millennials, this generation has pushed for better work-life balance, more flexibility, and better inclusion policies. So their expectations on how employers address perimenopause will also be really significant. And this isn't just a health issue. Perimenopause support is a strategic workplace priority that's tied directly to retention, to productivity, and to inclusion. By recognizing and responding to this life stage, organizations have a real opportunity to build more compassionate and a more high performing workforce. This, in turn, will enable organizations to deliver on their mission and achieve their financial objectives. So before we get into this conversation, let me briefly introduce myself, and I will ask my fellow speakers to do the same. So I am Wendy Sherry, and I am the CEO of Cigna Healthcare's global health benefit business. I have the privilege of serving the globally mobile populations to ensure that these individuals and their families have the benefits and support they need when living and working outside of their home country. Leah, would you introduce yourself?
Sure. Thank you, Wendy. Good morning, good afternoon, good evening, depending on where you are in the world today. My name is Leah Cotterill. I'm the CEO for Cigna Healthcare, based out of the Middle East and Africa. So supporting our global clients, our local clients, with quality access to care right across the region. Thank you so much for being here today, Wendy. And over to you, Tammy.
Thank you so much, Leah, and thank you, Wendy. It's really an honor to be here with two incredible women CEO leaders having this discussion, which is a sign, I think, of great progress in the world. My name is Tammy Sun. I am the founder and CEO of Carrot. We are a global platform for lifelong fertility healthcare, which includes preconception and pregnancy and IVF, but also, very importantly, perimenopause, menopause, low testosterone, and midlife support. And I'm honored to be here today to have this conversation and excited for it.
Great. So as you can see, we have a fabulous group here to have an important conversation, but we also encourage the audience to participate. We welcome you to use the chat function throughout the conversation, and at the end of our dialogue, there will definitely be time and opportunity for all of you to ask your question. So before we get started, I think it's super important that we maybe do a little bit of definition around some of the terms that we're talking about. So Tammy, would you help the audience better understand what we mean when we say perimenopause?
Absolutely. So perimenopause is a transitional period between, your fertility years where you're ovulating, getting your period regularly, and menopause. And it's a period of time that can last, 2 to 4 to 6 years sometimes. And importantly, it's when your key fertility hormones like progesterone and estrogen start to really fluctuate and change. So the same fertility hormones that help determine a healthy pregnancy or a successful IVF cycle, these hormones are starting to change. And the way that we proactively manage and support that transition through perimenopause can have a huge impact on her vitality as she enters her midlife. And so it often comes with different symptoms and experiences like sleep disturbances, nutritional changes are required, a better sort of focus on bone health. Hormone replacement therapy, of course, is a big topic. I know we'll talk about today, but it really is that transition period as you enter menopause. And I think it's really important just to point out that it's not a disease, right? It's not an illness. It is a natural part of life for every woman who has the honor of aging and living into that period of her time. And so I'm so excited that workplaces are really starting to prioritize it, because it is also a period of time where many women are starting to hit their sort of career strides, Wendy.
Menopause. And again, just to get those definitions out there and awareness, I know that even for myself, I'm learning every day around what we mean when we talk about perimenopause, even though I'm a little bit past that part of my journey myself. So Leah, we talk about, this is all about helping to ensure, folks in the workplace are able to support. So can you maybe talk about why this is such an important topic for our employer populations?
Yeah, absolutely. And I think actually the starting point is that many women experiencing perimenopause often don't even know that that's what their symptoms are, right? There's so much going on that they may not have the awareness that that is actually the life stage that they're progressing into. So I think perhaps it's not unexpected that there is fairly limited awareness and understanding of perimenopause amongst many organizations. And so at this time, it doesn't necessarily feature as a hot topic, if you like, in the sort of well-being and wellness conversations that are happening within organizations. So I think the first thing that's important for employers to be doing is raising awareness, right? Because perimenopause will have an impact on the well-being of women in the workplace, the productivity of women in the workplace, and even retention of women in the workplace as well.
And as you said, it's a conversation that is just starting to happen in the workplace, but impacts so many individuals. So, I'll just add a little bit to the conversation in terms of why we're focusing this conversation on the millennial generation. So, as I mentioned in some of my opening remarks, the millennials are now in their 30s and even their early 40s, and they represent the largest segment of today's workforce. 50% of these millennial women are already beginning to experience perimenopause symptoms, right? It comes as early as your 30s, definitely as you progress into your 40s. And as I said, also in some of my opening comments, the millennial generation is definitely a very influential group in terms of workplace policies, right? They have strong preferences around things like flexibility, around work-life balance, as I noted earlier. And as Leah, you were just saying, and Tammy as well, like very few organizations actually have these well-being policies that are in place today to support women who are starting to experience these symptoms. So I love that we're having this conversation to, again, raise the awareness so that more and more employers can begin to put these policies and support in place for such a large and impactful part of our population. So Tammy, what do you think are some of the misconceptions around perimenopause, and how can we work to break what in many ways is a stigma around it in the workplace?
Yeah, great question. I think the first stigma is really that it is a disease or a chronic illness of some sort, and in sort of shrouding it in that way, which is inaccurate, right? It is medically inaccurate. We have, I think, to your point, created a lot of stigma on this issue and an inability to have an open conversation about how we can better support women in the workplace as they are aging into perimenopause and menopause. And so I think the first, the millennial generation, and Wendy and Leah, you understand this as well. they were really the first generation to bring infertility, for example, as a conversation into the workplace. And now millennials really are at the forefront of driving this conversation as well about perimenopause and menopause. And it's having a huge impact. And so the first thing is really to create space in order to have the conversation, to confront the stigma and take away some of the stigma so that we can talk about policies, we can talk about workplace benefits, we could talk about where the gaps are in the healthcare system for this critical population. And we can also talk about the ways in which providing better support and providing better benefits actually helps your business, actually helps your bottom line, makes this a better place to work, and allows you to create better business impact and better business results. We see a ton of data in our research at Carrot about productivity and retention value, especially among your senior women managers and leaders. And so I think the first step is sort of what we're doing today, and I know what each of you are doing in your teams as well, is to create space for the conversation so that everything else can come after that. And so I think this is very much a global phenomenon. We've seen, a ton of conversation on this in the UK, across Europe, and we are starting to see a real shift in the US. But also, Leah, I'd love to hear your perspectives as well, just in your region, where you're seeing some of the progress that is happening. But conversation is really the first place to start, I think.
Yeah, I mean, I agree wholeheartedly in terms of the conversation as the first place to start, right? In many ways, if you think about where we were in our journey on mental health, right, and the importance of mental health and talking about it and breaking down the barriers and the stigma, which has now opened up so much in terms of the benefits and support that we provide each and every day to our employees and their families. So to me, this is the journey we're on with perimenopause, right? How do we begin to break down the stigma, have open conversations, which then in turn will lead to the pathways of providing the support that is needed for, again, more than 50% of our population and workforce. So Leah, maybe you can share a little bit in terms of how perimenopause support can actually be part of what is a wider well-being strategy for organizations, right? Because it is just one component of a broader conversation.
Right. Yeah, completely agree. And I think it's important that employers have a balanced strategy that covers a broad range of employee healthcare needs, including, of course, prioritization of women's unique health needs, shall we say, especially when you consider, and exactly to your point, that for an average organization, more than 20% of the female workforce may be navigating perimenopause or menopause at any given point in time. I think one of the latest stats is that 50% of millennial women experience moderate to severe menopause symptoms. So clearly awareness is key. We include initiatives such as employee workshops with specialist resources. Absolutely important in recognizing this life stage and beginning to normalize conversations around menopause. I think it's also really important to include male colleagues. I know that when I talk about menopause, many male colleagues and friends have actually approached me and said that they're looking for support as to how they can support their wives and partners. And I think as an employee approach this, it's really important to consider the role that culture plays in the approach to the discussion, and ensuring that you're creating an environment where women of all backgrounds feel comfortable to come together. So I think with increased awareness, helping employees navigate their benefits that can support them is all really, really important. And asking your benefits providers and what support they have in their solutions to support women through this life stages. Simply consolidating those in one place and making it easier for women to know that support is available to them.
So I don't know about you ladies. I'm hearing little bit of background noise there. So I'm going to try to muscle through a little bit and try to ensure that we
Oh my
continue
God.
to be an engaging
Me too. It's killing me.
But yeah, so Leah, I appreciate you sharing all of that information in terms of how everyone can support women in this journey, right? Employers, both male and female, right? Because again, it's going to take a village for us to be able to support women through this important life stage. So maybe I'll ask this question to both Tammy and Leah. So when you think about, as I talked about the millennial generations, their expectation for flexibility and inclusivity, how do you think that they are going to be able to influence how perimenopause is addressed in the workplace? What do you think their impact's going to be on this?
Well, I wanted to actually, in answering this question, I wanted to pick up on something that I did hear Leah say really clearly earlier, which is, women are very much, the three of us are very much at the forefront of pushing this conversation forward and sort of being the activation energy that gets it started. But it's super important to engage men in this conversation. Having the support of male leaders in the workplace who understand from a business perspective that this is the right thing to do for, half and sometimes more than half of your workforce is really important. And so bringing them along, helping to educate male leaders, creating space so that there are no dumb questions, is super important. And, I think doing that in a way that is sort of welcoming and not isolating, where this conversation is really only happening for women, by women, is something that, I'm really glad you raised, Leah.
Right? Obviously, it might be the women, right, who are starting this conversation, the 50% who are starting the conversation, but you are spot on. We need the other 50% in order for us to really make the headway here. And if you think about other stages of women's lives, right, whether it's when they are in their fertility age, right, and they're having children, right, certainly we have the entire population, both male and female, helping to support women and candidly men through that journey as well. So I'm really glad that you're making the point. It might be, again, women starting the conversation, but we need men and women to help solve the situation.
Absolutely. I mean, men should understand, Wendy, that 74% of millennial women who are experiencing menopause or perimenopause symptoms say that they would consider leaving their job in order to help better manage their quality of life. It's important to educate everybody, including women, of course, that there are ways that you don't have to just suffer through this period of life, that it isn't just it's not natural to just experience the pain and keep going. There are interventions, there are lifestyle changes, there are nutritional interventions, there's sleep support, there's hormone therapy. So there's a lot of different ways that women can take action so that they aren't just passively experiencing and thinking they have to live through some of the changes that are happening normally in their bodies.
Absolutely. Leah, any thoughts in terms of how leaders, how the broader workforce can help support employees through this?
Yeah, and I think as you quite rightly highlighted, Tammy, 79% of women state that they have to take time off for reasons related to menopause symptoms. And I think you referred to 74% consider leaving the workplace. I think the stat is furthermore that 1 in 10 actually do leave the workplace due to unmanageable menopause symptoms. So clearly there is a huge hidden cost on productivity and employee retention by doing nothing, which will only persist. So I think the case for supporting doing something is really strong. I mean, a few steps that we've talked about before that can really make a difference. I think manager training, equipping managers with knowledge to handle conversations sensitively and also help avoid that stigma as well. Flexible working, offering remote work, flexible hours, or reduced travel for those that are experiencing severe symptoms. Tammy, you asked me a little bit earlier on about this sort of regional sort of influence, if you like, on this topic. One of the things I was reflecting on actually as we were preparing for this session was, in some workplaces you can do reduced hours, perhaps, if people are struggling with certain situations. That sort of flexibility and sort of full-time down to sort of a part-time environment don't exist here. In fact, it's one of the reasons why working mums find it really difficult to get back into the workforce, because it's kind of all or nothing. So I think flexible working in whatever way it's possible in your environment is critical. I think also, one of the things that is a great idea is introducing an employee resource group, creating a community for peer support and knowledge sharing. And finally, there are options around sort of workplace adjustments, right? Little things like, perhaps allowing desk fans for those, hot flash moments, and perhaps a quiet room for recovering, during, a bit of fatigue or migraines, or, particularly focusing on sort of comfortable seating and lighting adjustments and things like that. So I think, we know holistically that there is a link between high vitality, and workforce productivity. I think workers across all generations that have a high vitality will report that they work harder, and they work harder to help their workplace succeed. So it stands to sense that when women in this phase of life represent such a critical part of the workforce, including in many leadership roles, that we really should step up and support women during this perimenopause and menopause period.
Yeah. Leah, I love so many of the examples that you just gave in terms of real and tangible ways that we can help women through this period of transition. And what I'm super hopeful about is that so many of the things that you've mentioned are things that we do already have in place for other conditions, right? Where we have resources available for people who are living with diabetes, or living with chronic back condition, or suffering from mental health, or going through pregnancy or postpartum, right? So in my mind, I have so much hope that we will have these types of support and solutions in place for the population of women that, will go through perimenopause, because it's not, if it will happen, it's when, right? So how do we ensure it's when? Exactly. And, as I've talked to other, they've done other types of discussions on this super important topic, I often say I'm a little bit jealous, right? That of the women who will come behind me, who will have this amazing support and be able to talk openly about this topic. Because again, when I was going through that journey, I wasn't able to talk about it as openly as I am today. So again, I'm very hopeful for the future of women, and not just women, but the workplace, and what it means in terms of the ability for everyone to be able to bring their best self to work. So, I don't know, Tammy, if there's anything else that you would recommend, right? You obviously sit in an organization who every day is providing support and tools to people throughout their hormonal health journeys, both men and women. So anything else that you might offer to this group?
Yeah. So, we spend a lot of our time, obviously, thinking about flexibility and how to deliver, to Leah's point, more flexibility into the workplace so that employers can better support a bigger and more diverse group of people. To your point, Wendy, Flexible schedules is a great thing to have. I also think that flexible access to support for their mental health, for physical health through virtual care is a thing that today exists for diabetes. It's a thing today that exists for infertility. And we are so excited to be able to deliver that solution for perimenopause, menopause, and midlife as well. And I think the ability to very easily on your phone, at your desk, at any time, get questions answered very quickly, related to sleep disturbances, related to, hot flashes, night sweats. These are just really important so that we sort of reduce the amount of bouncing around within the healthcare system that a lot of through access to a trained specialist in perimenopause and menopause. And you're at much higher likelihood of just bouncing around, thinking about a statin, thinking about an antidepressant, and not really getting the care that you need for a much longer period of time. So we make that kind of virtual support very easy for our customers. And I think similarly to you, Wendy, we're just at the beginning of being able to do that. So it's very exciting.
Yeah, and Tammy, thanks for mentioning some of the unique things that your organization is able to bring in terms of not only support tools and education, but also professionals that are uniquely expert in this stage of life. And that's exactly why we've chosen to collaborate with you in terms of being able to support our globally mobile populations. I think it's clearly evident in this conversation that the starting point for best supporting millennials as they're beginning to, or even already are experiencing these symptoms of perimenopause is to first start with acknowledging it, right? Acknowledge it. You said it earlier, right? It is a privilege to make it to this part of the journey, right? So don't make it a bad thing, but just how do we acknowledge it and support it? And we've, through this conversation, identified many ways in which you can do that. Leah, you and Tammy both brought up some really great specific examples of the types of tools, support, et cetera. So, this is the ask for organizations to listen, acknowledge, and provide the support, because again, that is the best way for everyone to show up as their best self, which, as we know, in turn will enable organizations to achieve their purpose, performance, all of those great things. So I know I asked in the beginning of our time together, let's have some audience participation. So I think we're about ready to see maybe what questions have popped up in the chat throughout our dialogue together. So I am seeing a question here, which is, I'll read the question. Are current well-being benefits covering the needs of millennials as they move into midlife, or are they still too centered on early career and parenting stages? So happy to turn it over to Tammy or Leah. Tammy, you want to start with maybe your reaction to that question?
I'm happy to. And it's such an excellent question. And one of the things that is really, I think people don't realize is how connected all of these phases are, and not just connected, but beginning to overlap. You can start to experience perimenopause symptoms in your mid-30s as a woman. And this is a period of time where, yes, you're starting to see your hormones fluctuate, but you can also get pregnant during this period. And we are seeing demographic changes, for example, where women are having kids later and later, and they're starting and expanding their families all over the world. Later into their 30s. And so there is a fertility window, there is a pregnancy window, there is a perimenopause window. And for more and more women, these experiences can become very connected and in some cases overlapping. And so I absolutely agree that as as policymakers and as benefit leaders and as company leaders, we start to evolve the way that we think about supporting women, not just as they are trying to get pregnant, not just as they are struggling with infertility, but also in their post-reproductive fertility care as well. And there are really these two phases. It's how we think about it as Carrot. There is a reproductive fertility care phase, and then there is a post-reproductive fertility care phase, and there is that period in between. And so holistic, comprehensive support really does, span what we think about as lifelong care. And it's a multi-decade period of time.
I don't know, Leah, if you have anything else to offer. Yeah, go ahead. Go ahead, Leah.
Yeah, no, I just a couple of thoughts. I think it's absolutely right that we're still fairly early on in that evolution. And I think one thing that has become incredibly clear, perhaps COVID was a funny sort of catalyst for this, that one size really doesn't fit all. And and as Tammy describes, we've got people going through life in at different stages. I mean, there are ladies that perhaps had their children earlier on in life. There are people that have them a little bit later in life. Then you start to blend these different phases, and then there's the support of the family and husbands and wives, and there's everything that goes with that. So I really do think that recognition that one size doesn't fit all, but that we have to try and have a very holistic approach is really critical. And I think I can't leave this session without making the point that for us having the privilege as female leaders, right, as CEOs of companies and as leaders of people, that as women, it's incumbent on us to have these conversations and make it okay, create a culture where it's okay to talk about menopause, and that people can come forward and share their experiences and how they're feeling, and we can really create that environment for the future.
Yeah, no, I couldn't agree more. And, there was something in your answer, Tammy, around, we're also seeing the emergence of, some of the regulations around this. And I often say to people, let's actually ensure that we're providing the right support, tools, benefits, et cetera, and not have to wait for the regulations to mandate these types of things, right? I always think that it's much better to do it ahead, if you will, of the regulations. So what do you think employers might be able to do to help better understand the needs of this population, right? Because if you think about it, if what we're saying here is employers need to provide more support, more tools, et cetera, is there something that employers can do to better understand how best to meet the needs of this population? Leah, any thoughts there?
Yeah, absolutely. I was actually with a client earlier on today. Oh, sorry. No, I was actually with a client earlier on today, and one of the things that we were talking about was a holistic wellness calendar, if you like, and that's exactly what we spoke about. Was how do we get inputs to what is most important to your population at this moment in time? So I think again, employers not being afraid to ask. Perhaps that's through surveys, perhaps that's through sort of employee councils, that sort of thing, to ask what's most important, put some ideas out there, and really trigger some incoming feedback. Otherwise, we can end up with these sort of traditional old topics. I know in our office, actually on Wednesday of this week, we're celebrating International Men's Day. And this was in response to doing a really, really good panel discussion around International Women's Day. And I threw out a challenge to the guys and said, look, we do this every year. Like, come on, bring forward a panel for International Men's Day. So So much of it for me, Wendy, and you and I are very similar in this way, is really about culture. It's really about creating that environment for people to be able to speak up. And if people need a survey to do that, then that's fine. But I think getting input from the people, the teams, is absolutely critical.
Yeah. Leah, I will just tell you that since I've started to do more conversations, more discussions on this topic, I cannot even tell you the countless number of employees that have proactively addressed me with this topic, right? So again, it's all about normalizing the conversation, because that, again, gives people not only the confidence to come forward, but it also, you realize you're in this much larger community of people, right? You are not, crazy because all of a sudden I can't remember 3 things from 10 minutes ago, right? This is something that a lot of other people are experiencing at the same time. So just, again, we just need to keep leaning into having the conversation so that people will naturally, to your point, they'll bring forward what they need. Surveys being certainly a good tool, but not the only way to do it. Tammy, any thoughts from you on that topic?
I will say, I think, the conversation is hugely impactful in terms of changing workplace culture. But what I think is equally exciting is the way that the conversation is helping to advance some of the regulatory aspects as well, to your point. In the United States, the FDA just removed the black box warning for hormone replacement therapy maybe a week or so ago. And that is a really big step that will enable many more women to access the kind of treatments and interventions that they need to live with better vitality. And that change, I think, in large part was a function of the ability for us to have bigger, bolder, more confident public conversations about this, certainly in our own lives, in online spaces, and at work. And we're seeing some of those patterns and those outdated regulations change globally as well, not just in the United States. In many places around the world, there's active discussion about rules, policies, regulations that are outdated and holding women back in terms of being able to access their fullest lives and the best treatments for them as they enter midlife. And so it's really exciting to see how all of these different pieces hang together. And as women leaders, I just want to recognize that the impact when you speak up at work, the impact is yes in your company, yes in your employee base and your friends and your colleagues at work, but just know that it is having a much broader as well. And we're seeing policy changes that are a culmination of all of those conversations.
I couldn't agree more. Well,
and Tammy, sorry, I think we've got a little lag. I was just going to add on to Tammy's point there, and again bringing back to what she had asked me earlier in the session around the sort of regional nuances. Last year, we sponsored the inaugural GCC Menopause Summit, and we did the second one again just about 2 or 3 weeks ago. And I think those sorts of things. I mean, standing or sitting on a stage in Dubai with 250, 300 people talking about menopause with guys on the stage as well, just felt like such a huge achievement. If you think about the sort of the surrounding cultural dynamics, it was a huge achievement. So I think exactly to your point about speaking up and driving advocacy and raising awareness socially in the community, all these things have to have a great knock-on impact. And thank you, Wendy and Tammy, for all of your speaking up and advocacy as well. It goes a long way.
Yeah, no, Leah, I mean, I applaud you for putting that together and starting this conversation, because as I've said multiple times now, right, that's the way to normalize the conversation. So I can't even believe it, but we are actually at the end of our time together. And it's been just an incredible honor, first of all, to have this conversation with all of you and to begin to really, again, normalize the conversation, drive awareness to the importance of this topic and how this topic can help to impact so many women's lives. And that, again, it's a strategic imperative for so many companies. I mean, I cannot wait for 5 years from now when the three of us get back together to talk about this topic and the advancements that have happened over that 5-year period, because I see wonderful things. I'm incredibly optimistic and hopeful for this future and for the future and the impact that it will have on all women and all businesses for that matter.
It's a date, Wendy, and in 5 years, we'll be joined by some guys around the table.
Exactly. Awesome. Well, thank you again, and thank you to the audience for all of your questions and participation. I wish you the best in the rest of your day or evening. Take care.
Thank you, Wendy. Thank you, Leah. It's great to see you both.
Thank you. Thank you. Take care. Bye-bye.
Have a good one.